We spend about a third of our entire lives asleep. Or at least we're supposed to. But what happens when that time is just a constant struggle?
Well, in this explainer, we're going to dig into insights from the Westminster Clinic to really uncover the truth about sleep disorders, what they are, and how we can find our way back to a good night's rest.
It's such a familiar feeling, isn't it? You know the one. The ceiling is the most interesting thing in the world, the clock on your phone is just mocking you, and you are literally begging your brain to just shut off. But what happens when that one bad night bleeds into another, and then suddenly it's been weeks?
And that's exactly when a frustrating problem can turn into a really serious issue. See, chronic poor sleep isn't just about feeling groggy the next day. It creates this huge ripple effect, messing with our mood, clouding our memory, and taking a major toll on our physical health.
So, to really get what's going on, we have to look way beyond just feeling tired. Let's start by breaking down what these conditions actually are on a clinical level.
Okay, so what exactly is a sleep disorder? Well, to put it simply, it's any condition that consistently gets in the way of a good night's rest. And it's not just about the number of hours you spend in bed, it's all about the quality of that rest.
But here's the thing, sleep disorder is a really broad umbrella term. It is definitely not a one-size-fits-all problem, and understanding the specific types, well, that's the absolute first step to finding a solution that works.
All right, let's meet the most common culprits. First, you've got insomnia, the one we all know, that super frustrating battle to fall asleep or, stay asleep. Then there's sleep apnea, which is a more serious condition where you actually stop breathing for moments at a time. It often goes hand in hand with loud snoring. There's also restless leg syndrome, that maddening gotta move your legs right now feeling. And finally, circadian rhythm disorders, which is when your internal body clock is just totally out of whack with the world around you.
So this brings us to a really crucial question. When does having a few bad nights cross that line into something that actually needs professional attention?
Honestly, the warning signs are often way clearer than we think. If sleeping is a struggle for you most nights and it's leaving you just exhausted and irritable all day, that's a huge red flag. If there's loud snoring or gasping sounds, that could point right to apnea. And you gotta pay attention to the behaviors too, like if you're relying on something, anything, to fall asleep, or if you actually feel anxious or scared about bedtime. All of these are signals that it's time to get some help.
And this is exactly why getting help is so important. I mean, the stakes are really high. Leaving these conditions untreated isn't just about being uncomfortable. It can seriously increase your risk for major health problems, both mental and physical, down the road.
But here's the good news. There is a clear path forward. And the goal isn't just to manage the symptoms, it's to actually restore natural, truly restful sleep.
A professional approach is really structured, but it's also incredibly personal. It always starts with a deep dive, a super detailed assessment of your unique sleep patterns, your health, your lifestyle, everything. From there, they create a customized plan just for you. This is no cookie-cutter solution. And, this is key, it includes follow-ups to make sure things are working and to adjust the plan as you get better. Think of the treatment plan kind of like a comprehensive toolbox, not just a single hammer. It could have all sorts of things, like targeted therapy, medication if it's necessary, practical lifestyle changes, and even mind-body techniques like mindfulness. The whole point is to tackle the problem from every single angle.
And inside that toolbox, there's one tool that is widely considered the absolute gold standard for insomnia. It's called Cognitive Behavioral Therapy for Insomnia, or CBTI. Now, this isn't just about talking. It's a proven, evidence-based approach that helps you actively change those unhelpful thoughts, the I'm never going to fall asleep ones, and the behaviors that keep that cycle of poor sleep going.
But this is a question that comes up all the time, right? In our world of quick fixes, it's so tempting to think a little pill can just solve the whole problem. But does it actually cure it?
Okay, here's the fundamental difference. Sleeping pills are a temporary patch, a Band-Aid. They might knock you out for a night, sure, but they don't do a single thing to address the root cause of the problem. Therapy, like CBTI, on the other hand, is designed to be a long-term solution. It works by retraining your brain and your habits, getting to the why behind the sleeplessness, and actually giving you the tools for lasting change. And what all this really shows is an incredibly hopeful reality. With the right, comprehensive approach, restoring your natural ability to sleep well isn't just some dream. It's completely and totally achievable. And the results can be surprisingly fast. Seriously, we are not talking about years of work here. People often see real, tangible improvements in their mood, their energy levels, and their focus within just a few weeks of starting on the right track.
So we'll end on this question. Just think about it for a second. More energy for your family, better focus at work, a brighter mood every single day? You see, effective treatment isn't just about sleeping. It's about reclaiming your life. So what would that look like for you?